Hello, my name is Engee. Today's topic is coronary artery disease, CAD. Every beat of the heart is a sign of life, a continuous rhythm that keeps us alive. But what happens when the very vessel that supplies this life becomes blocked? Coronary artery disease, also known as CAD, is one of the leading causes of death worldwide, often developing silently until it's too late. Coronary artery disease begins with the buildup of fatty deposits known as plaques. Inside the coronary arteries, over time, these plaques harden and narrow the vessels, restricting blood flow to the heart muscles known as the myocardium. As blood flow decreases, the heart muscle is deprived of oxygen, leading to ischemia and necrosis. If this continues, the tissue begins to die, resulting in a myocardial infarction, commonly known as heart attack. What starts as a small buildup can become a life-threatening condition. Take a look at the image and compare the healthy heart versus heart with myocardial ischemia. What are the risk factors? Coronary artery disease doesn't happen overnight. It develops through a combination of risk factors. Some we can control and others we cannot. Modifiable risk factors include smoking, poor diet, obesity, physical inactivity, and stress. Non-modifiable factors include family history, age, genetics, sex, and ethnicity. Two of the most significant contributors are hypertension and hyperlipidemia. Uncontrolled high blood pressure creates a continuous strain on the heart, while high cholesterol increases plaque formation, occluding blood flow. Clients with history of smoking, those of advanced age, and those with diabetes mellitus already have decreased circulation. The risk becomes even greater. High blood pressure, unhealthy weight, high cholesterol are the risk factors. What are the clinical features? Interestingly, many clients remain asymptomatic, that is symptom-free, until the coronary artery is 50 to 70% blocked or occluded. The most common symptom is chest pain, known as angina and pressure. Stable angina occurs with exertion and is relieved by rest. Clients generally know when this is going to happen and how to relieve this. But as the disease progresses, unstable angina may occur unexpectedly and unpredictable intervals. Severe and even at rest because the coronary artery is becoming more and more occluded. Some clients, especially women, older adults, and those with diabetes mellitus may present with atypical symptoms such as shortness of breath or dyspnea, lightheadedness, heartburn, dizziness, or even indigestion or epigastric pain. As coronary artery becomes more occluded and blood flow continues to decrease, pain may start to radiate to the stomach, arm, neck, or jaw, a warning sign that should never be ignored. What are the clinical features? Diagnosing coronary artery disease involves several key investigations. A 12-lead ECG can reveal changes in heart activity. This can be in form of ST elevation or depression, depending on the level of artery occlusion. Cardiac stress tests such as a nuclear stress test or exercise treadmills stress test can be completed to help determine how much exertion the client can control. The heart responds to physical exertion. This can especially be helpful if the client completes 6 stress tests at regular intervals, such as every year. And the healthcare provider can review results to determine disease progression. For a more detailed view, Cardiac catheterization can be performed to allow healthcare provider to directly visualize blockages within the arteries and determine levels of plaques internally. For clients with coronary artery disease, blood tests also play a role, showing elevated triglycerides, increased LDL, and decreased HDL levels, that is the good cholesterol. Together, these tools help uncover the hidden dangers within the heart. What are the nursing interventions? Antiplatelet drugs like aspirin or clopidogrel can be given to prevent platelet aggregation or buildup within the arteries, as well as prevent clot formation. Nitrates such as nitroglycerin can be given to vasodilate the coronary arteries and improve blood flow. Managing coronary artery disease requires a combination of medication management and, in some cases, surgical interventions. Cholesterol-lowering medications such as statins will reduce lipids and cholesterol levels, slowing plaque formation and buildup. Other medications such as beta blockers, ACE inhibitors, and calcium channel blockers reduce the heart's workload in pumping blood to the body. If the plaques becomes too large, or if the clients begin experiencing uncontrolled symptoms of coronary artery disease and medications are not enough intervention, some surgical procedures like percutaneous coronary intervention or PCI may be performed during cardiac catheterization. A catheter is inserted into the body through the femoral artery, sometimes the radial artery, up into the arteries of the heart. Here, the plaques can be ballooned or stented to increase blood flow. If plaques becomes too large or too dense to be stented or ballooned, coronary artery bypass grafting (CABG) surgery can be performed. In CABG, a vein is taken typically from the leg and sewn in above and below the blockage. Rather than going through the blockage, we go around or bypass it to restore blood flow. In some cases, coronary artery bypass grafting (CABG) creates a new path for blood to flow, bypassing the blockage entirely. What are the teaching, the nursing education to the clients? Prevention is just as important as treatment. Clients need to be taught to maintain strict blood pressure control and adhere to prescribed medication regimen exactly as prescribed, as well as to keep a log of blood pressure to ensure proper control. Smoking cessation is critical, supported by therapies like nicotine replacement, such as nicotine patches, or medication like veranectines that bonds to the same receptors in the brain as nicotine can be helpful in reducing the urge to smoke. A healthy lifestyle includes regular exercises, stress management, medication, guided imagery, a balanced diet rich in healthy fats such as polyunsaturated fats like salmon, avocados, and flax seeds. Whole grains and fibers are to be encouraged, as fibers help to reduce cholesterol levels. Examples are beans, berries, broccoli, etc. Clients should be encouraged to maintain ideal body weight. Simple changes can make a life-saving difference. Coronary artery disease may develop silently, but its impact is profound. Through awareness, prevention, and proper care, we can protect the heart, the very organ that keeps us alive every second, every bit. This ends today's topic. See you next time.